expect that your healthcare professional will check your perineum for any tearing that may have occurred during the birth process. You may require 1 or 2 stitches. Your perineum will feel sore over the next few days. Be mindful to allow it to rest. If you have had stitches, they will dissolve. Your healthcare professional will check healing at 6 weeks after the baby is born, unless you feel a pulling sensation or irritation to the area before that. Your fundus, or the top of your uterus, will be felt to ensure that it is a firm central ball at about the level of your belly button. Over the next 2 weeks, your uterus will move back into its pre-pregnant position in your pelvis. It is important to empty your bladder after birth to allow your uterus to move down. Some women feel afterbirth pains as their uterus moves back into its normal position, particularly while breastfeeding. This usually resolves after a day or 2. You might find a hot pack and breathing or relaxation exercises helpful. The first breastfeed is recommended within the first hour after birth. It helps the uterus to clamp down, particularly if you have had a natural 3rd stage. Blood loss after your baby is called lochia. For the first 2 or 3 days it can be quite heavy, and then it will become more like a normal period for you. Then it may gradually turn brown, and then a white or yellow discharge. Some women will have some discharge for up to 6 weeks after the birth. Your body will gradually pass much of the fluid that you accumulated through your pregnancy over the next few days. If you find urination stings, talk to your healthcare provider. Many women also worry about opening their bowels. It is normal not to open your bowels for 2 or 3 days after the birth. If you are worried, some softeners can be used. However, most women do not need them. Remember the importance of your diet and rest. It is easy to forget to look after yourself when you are so busy with a new baby. Liz, our physio, will talk to us a little bit more about general postnatal care, in particular care of your perineum and getting your pelvic floor muscles back to normal. Your baby will be weighed, measured, washed and/or dressed when convenient. There is no hurry or real need for a bath. The vernix on the baby's skin does help to protect their skin. There are many tests and immunisations that will be offered to your baby from birth. Vitamin K is an injection or an oral dose of a vitamin that assists in blood clotting and can prevent a bleeding disorder in newborns due to a deficiency in vitamin K at birth. You may also be offered one of their first immunisations, hepatitis B. It is totally up to you whether or not you immunise your child. The newborn screening test is a heel prick test for blood. It is tested after baby has been feeding for 2 or 3 days to check for disorders of metabolism, such as cystic fibrosis, galactosemia, PKU and hypothyroidism. If you don't hear anything from this test, this is good news. Baby will be checked from head to toe. If there are any signs of baby being unwell, they may be admitted to a special care nursery. For the first 2 or 3 days, your baby will receive colostrum, which is liquid gold. It will be dark yellow in colour, small quantities, but full of antibodies. Over the following few days, your milk will change to mature milk, and baby's bowel motion will turn from a tarry black meconium to brown, green, and then a runny mustard stool. This is normal.